My name is Carrie Cutler and I'm a nurse practitioner here at Ageless Forever. I often get asked who is a good candidate for bioidentical hormone replacement, and quite honestly, mostly everyone is. It really depends on past medical history, but most patients, whether it's medications, bioidentical hormone replacement, vitamins, herbal supplements, are good candidates. I often get asked, well, how does an appointment generally unfold here at your office? How do I come to see you? How do I know that I'm a good candidate for this? Typically what happens is that a patient will call the front desk, schedule what we call a meet and greet. Once the patient comes in for their meet and greet, at that point in time we do have a lab tech who is here in our own private room full time. Those appointments are scheduled every 30 minutes and the appropriate labs are drawn, which take approximately 2 weeks to come back in full. And at that particular time, a patient comes in, sits down with myself or Dr. Pierce for approximately 30 minutes to 1 hour, and we go through everything, every lab value, every test, and explain everything fully to that patient so they understand, what is going on, what it means, and what the appropriate treatment plan potentially will be. At that time, we will prescribe the appropriate medications, vitamin supplements, and we'll see that patient back in about 6 weeks to retest those pertinent labs and reevaluate their symptoms. What I really like about wellness medicine is that it is symptom driven. The numbers are very important to us, but really how the patient is responding and how they're feeling drives what we do.
Pond 5.